Welcome in, everyone. A brand new edition of Sports Medicine Weekly on this Saturday morning. I'm Steve Cashel, joined by my usual co-host, Dr. Brian Cole. He is a sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush, also the head team physician for the Chicago Bulls and one of the team physicians for the Chicago White Sox. You can follow us on Twitter at SMW Home. We also have a Facebook page as well, and our website is sportsmedicineweekly.com. Our producer, Shane Reardon. Our coordinating producer is Tracy Taro. And Dr. Brian Cole, how are you this morning?
Steve, I'm doing great this morning. Thank you.
Good. Well, we're still in the middle of this COVID-19. I'm waiting for the end to be near so I get my boys back in school and into sports, which I really enjoy watching them play. But obviously, we've got to be safe out there. So we will stick to what the governor is instructing us to do. But to start our show, Dr. Cole, I want to bring on a great guest, Dr. Julia Bruni, primary care sports medicine physician from Midwest Orthopedics at Rush. I understand there's a lot of investigational trials going on, including some at Rush, but I want to specifically talk about plasma therapy for COVID-19. We'll start with Dr. Cole. What can you tell us to lead into Dr. Julia on this?
Well, to start, as a clinician at Midwest Orthopedics, we also have faculty appointments at Rush University Medical Center. And as many people know, Rush is one of the top 35 centers of excellence that has been appointed and is managing some of the sickest patients with COVID-19. And the hospital is basically, at the current time, has been preparing for several weeks and has kept pace with the demand, which is really the reason, Steve, that we're going through all of these efforts to create a scenario where the hospital system itself is not overwhelmed. I would tell you that we're all very proud to be affiliated with Rush. They're doing amazing work, probably some of the best work in the entire country related to managing the sickest patients. And when it comes to saving lives, I will tell you that Rush was built for this type of challenge, and they're doing an exemplary job compared to what's going on in the rest of the world. And we owe a debt of gratitude to the clinicians and the leadership that has been dedicated to managing this problem. Flipping to the clinical trial side, yes, there's a number of clinical trials, Steve, that are going on, and I thought it would be great to have our next guest is Dr. Julie Bruni, is also my partner. She also helps manage the Chicago Bulls, the Chicago White Sox, and DePaul in terms of team physician responsibilities. And I thought she could tell us about some work that's being done around the country with recovered plasma. And the audience may or may not know much about this, but she's in a great position to explain it and educate us. So, Julie, thank you for joining us this morning.
Yeah, absolutely. Thanks so much for having me, Brian and Steve. It's wonderful to have outlets to inform people about what they can do because, you know, many people, I think, have been stuck at home and want to have ways to help and to help other people and don't know how to do that. And I think that the clinical trials that are going on with what we're calling convalescent plasma, which is basically using people that have recovered from the virus, using their blood antibodies to help treat both critically ill people and also even they're thinking of using it even prophylactically for high-risk people or folks that are on the front lines taking care of patients to help boost their immunity. And there's some really great trials going out right now. One specifically is through Johns Hopkins. So that's more, treating people on the East Coast. And there's been some really, really promising information coming out about using convalescent plasma to help treat people that are sick or are at risk of getting sick of COVID-19. The study that I am pushing and am interested in is through Mayo Clinic and the Red Cross. And again, it's very simple. If you are someone who either has been tested positive and recovered, or if you have had symptoms and recovered and are positive and you don't even, recovered, you don't need to have been tested positive, you can go to redcrossblood.org, and there's a survey that you fill out and someone will reach out to you from the Red Cross and let you know if you are an acceptable candidate or not to be able to donate your plasma and your antibodies to a person in need.
Again, we're visiting with Dr. Julia Bruni, primary care sports medicine physician, Midwest Orthopedics at Rush, talking about plasma therapy for COVID-19. I'm Steve Cashel with Dr. Brian Cole at his Sports Medicine Weekly. How can someone who's recovered from COVID donate their plasma to help, Dr. Bruni? Is it just going through that website the best way?
Yes, absolutely. So again, it's redcrossblood.org, and the front page of it, the first thing that on the top banner is all talking about COVID plasma donations. So it's very easy. You click on the link, and then if you or someone you know thinks that they may be a suitable donor, you fill out a survey, and then within a short period of time, you will hear back from the Red Cross. Probably with an email with some follow-up questions to determine where you can donate and if you are an appropriate donor.
Dr. Cole, it's the first I've heard of this, and really enlightening, and you never thought that those recovering who were confirmed cases of COVID-19 are able to help others. I think it's fascinating.
It is, Steve, and we clearly have to, this is one of those things where you have to continue to look under the hood for opportunities to treat people. Clearly, the FDA has loosened up some of the restraints on emerging treatment solutions. We have to be very careful about making conclusions without good science. It's really interesting when you read some of the work on Plaquenil or hydrochloroquine, which is a anti-malarial drug. There's so much controversy. One study that provides hope can take on a life of its own when the science necessarily isn't there. And the good news is that this recovered plasma is the subject of high-level research. There are more than enough patients now to be treated, and it's very promising and it makes sense. But it's like any new treatments, they have to pave the way to figure out what the potential adverse consequences are and so forth. So it's all done under the guise of a clinical research now, and hopefully something promising will come of this. And we're indebted to Dr. Bruni for helping further our sense of awareness, because these are things that we need to vet properly and do it in short order to see if we can make a difference to help treat some of the sickest people throughout the country and throughout the world, actually.
I agree with you, Brian. And again, the only way that we can make science happen is by doing these trials. And so the reason why I've been so impassioned to spread the word out there is that this is how this happens. This is how we get the data that helps us determine how we need to treat all these sick people and how we need to prevent other people from getting sick and perhaps even talk about vaccines. So I think the Red Cross and Mayo Clinic and Johns Hopkins have been doing an unbelievable job. I think Rush has done an unreal job taking care of our sick patients. I have a very beloved family member who is currently in the ICU on a ventilator right now. And so I just also want to give a great thanks out to everybody at Rush who's been doing just a fantastic job taking care of our sick patients.
Dr. Bruni, we thank you so much. We wish you best of success and best of luck, and our prayers to that family member. And thank you so much for joining us here, Dr. Julia Bruni on Sports Medicine Weekly.
Thanks, guys. Stay